This is Pharmacology Exam 4 covering the beta-lactams. This is taking another angle on it, starting from the disease and what you'd use in the case of each different disease or bacterial infection. So starting off, we have a patient presents to the clinic with, and then I'm just going to fill it in. So this first one's syphilis, which is known as treponema pallidum. Syphilis is given through a spirochete. And all these first ones here that are listed are going to be covered by the natural penicillins. So we have syphilis, S. pyogenes pharyngitis, and group B strep, all covered by natural penicillins. So the way we're going to memorize that is that there's a penicillin. Okay, so if you remember this picture, you think of a spirochete. It's one of those spiral pens. There it is. That's covered by a penicillin. Okay, and then here we have a guy who has a pen coming out of his mouth, but his pharynx is on pyro or fire, so Streptococcus pyogenes. Also, you just think that all of the Streptococcus can be cured by anything, so you use the one that's the most narrow spectrum, which would be the penicillins. So here is, this guy's pharynx is on fire, and lastly, it's used for group B strep for neonates. So under this one we have a B, which stands for group B, but also for baby, and this neonate has holding a pen to help you remember that it's penicillin. So that is what you would use for syphilis, S. pyogenes, Streptococcus pyogenes, and group B strep. Notice these are both include Streptococcus too. Next, non-Mrsa staphylococcal infections. So for this one, the class of penicillin is called anti-staphylococcal penicillin, so that should kind of be the giveaway. But in case you can't remember that, maybe if you can just remember that nafcillin, Na is the term usually used for sodium. So over here I drew a staff with the grape-like structure of the coccus, and here's some salt also to go with your meal, I guess, whatever. So here's Na to stand for nafcillin, associating that with non-Mrsa staphylococcal infections. Next, if a person presents with, oh, by the way, these staphylococcal infections are usually going to be skin infections. Okay, so now going down here to otitis media. So a patient comes in with, the ear infection, or they have Listeria monocytogenes. In the case of this, you're going to use the aminopenicillins. Remember, the aminopenicillins are both the ones that start with A, amoxicillin, and also ampicillin. And these are the most popularly used antibiotics according to the lecture. So earlier I had a way to remember both of these, what they're associated with. I'll just write that out really quickly so that it can be a review. So if you remember, amoxicillin is given orally. Okay, and the way that I remember that is I had the moccasins and they had a smiley face on them. So there's smiley face moccasins for oral, there's a little mouth. And then ampicillin was given IV. And the way that I remembered ampicillin was I had an amplifier, like a guitar amplifier, and also what's associated with these, amoxicillin is going to be associated with clavulanic acid, because you think cavemen wore moccasins. Clavulanic acid, cave, whatever, clavulanic acid. And also ampicillin is associated with sulbactam, because you remember that in order to play your soul music, your blues, you got to have your amp to play that music. Okay, so that actually works in well, the ampicillin works in well with Listeria, because Listeria kind of sounds like listen, L-I-S-T, listen, Listeria, and also is associated with otitis media. So listening, Listeria, and otitis media, ear infection. And this works for the aminopenicillin. So I try to make this guy look mean. I don't know if that works, maybe it doesn't. But there he is. There's amino for aminopenicillins for otitis media, Listeria monocytogenes. Next we have Pseudomonas aeruginosa. So if somebody comes in with Pseudomonas aeruginosa, last year the way I memorized this bacteria was I thought it kind of looked like Arugina pseudomonas, Aeruginosa, Arugina pseudomoni. Yeah, anyway. So Pseudomonas aeruginosa, and with this one I have you treat with two different ones you have here, but these are the anti anti-pseudomonal penicillins, which of course makes sense since it's pseudomonal, anti-pseudomonal. But in case you can't remember that, that's the case, what I have here is you remember that whether it's ticarcillin or piperacillin. I drew a dollar bill. So for moni, or Pseudomonas, money, I don't know, it kind of sounds like money to me. Anyway, the guy has a pipe coming out of his mouth. I don't know if you can see that or not. So think of a dollar bill, mona, with a pipe, and then also the ticarcillin. That helps you remember piperacillin. And then over here, also I drew a tiger grabbing the dollar bill, so you can remember that's associated with ticarcillin as well. Okay, so what if somebody comes in with a soft a skin or soft tissue infection, and you find out it's most likely going to be a gram-positive aerobic infection, and the person says that they have a penicillin allergy. Okay, this could also be in the case of surgical wound prophylaxis. So they come in, they've got this infection, but you can't give them dicloxacillin or nafcillin because they say they're allergic to penicillin. So what you might be able to give them is one of these first generation cephalosporins, such as cefalozin and I got that backwards. It's actually maybe not. I thought it was cefazolin. I think that actually is backwards. Cefazolin and cephalexin. So cefazolin is going to be, I think Zolon kind of sounds like Zorro a little bit, and cephalexin obviously sounds like somebody's flexing. So here I drew a picture of Zorro flexing. If you also remember, cefdroxazil was also in this group, so he was holding up some rocks in one hand, and cefazolin is given IV, and cephalexin is given orally. So he has a tattoo of a smiley face on his flexing muscles to remember that that's oral, and he has a Zorro sword, just poke people intravenously with his Zorro sword, but lo and behold, he has a soft tissue skin infection. That's why he took his shirt off, is because he's infected. So, and it turns out Zorro is allergic to penicillin, little known fact. Okay, so there you go, you remember that, this skin soft tissue infections are associated with Zorro. Next we have urinary tract infections. So Proteus Vulgaris. So obviously Vulgaris sounds like vulgar, so I had to make something vulgar for this one. So what's something vulgar and gross? I drew a picture of an ox going pee. And so that actually also helps because we know this is urinary tract infections. So this is the urine of the ox going pee. And the reason why I drew an ox is because cefferoxime is the one that's used for, is one of the third generation, no it's not, second generation. And in fact, if you want to remember this second generation, just remember make this even more vulgar. This ox is wearing a tutu for second generation. So a weird vulgar ox wearing a tutu that's going pee because he has a urinary tract infection. So there you go. And also cephalotetan works for that as well as just any second generation. Okay, so next we have community-acquired pneumonia, gonorrhea, and bacterial meningitis. Now that's a lot of stuff to remember, but one thing you can think is, remember there's a lot of things to remember, but there are a lot of third-generation cephalosporins. So that might be a way to remember some of that. So you've got a lot of things to pick from, and a lot of problems that are associated with it. So to help remember this was kind of hard. I drew a picture of a guy over here, and this guy, he had his meningitis is when your meninges that kind of surround your spinal cord and everything are inflamed, and so I tried to draw his brain because it's kind of part of the nervous system, so his brain is on fire because of inflammation, and then I drew his pair of lungs here to show he has pneumonia, and then I drew his genitals because he has gonorrhea, and that is a sexually transmitted disease. And so meningitis, pneumonia, and gonorrhea are associated with third generation cephalosporins. And he's saying fix me, which helps you remember cefixime, and also there's an axe up here because he was thinking of doing something awful because he felt so terrible, to help you remember triaxone. And also remember here triaxone, it can be given both intramuscularly and intravenously, and it is biliary excretion, so through the liver or hepatic excretion. Next one here, if a patient comes in with neutropenic fever, And they have Pseudomonas aeruginosa. Notice this is a repeat. Pseudomonas aeruginosa was also up here. But if a patient comes in with Pseudomonas aeruginosa, you're probably going to use this one first because this is a much more serious one. And you actually, in order to use a fourth generation cephalosporin like cefepime, you actually have to have some kind of like special license or permit or something because it's such a big deal, I guess. That's what it's in the reading. So neutropenic fever. Somebody comes in neutropenic fever, use cefepime. So what I drew here, I drew a pine tree because cefepime kind of sounds like pine. A pine tree, and a pine tree is on fire because it's the fever. You feel inflamed when you have a fever. And neutropenic fever is when a person has a low amount of neutrophils. Lastly, we have a person coming in with Mrsa. Well, we only have one thing out of the beta-lactams that can handle Mrsa, and that's going to be ceftaroline. And so that's just, you just know that because that's all there is.